coronavirus invaded every household in the United States, 500,000 people have died in this country. In Alabama, mothers, fathers, daughters, and sons have said goodbye to 9,660 souls. COVID-19 has left no person untouched, and our state is forever changed. As we navigated the first 2 weeks of the legislative session, those losses were never far from our minds. We are again reminded of the importance of the work that must be done in the State House. Work to keep our hospitals open, to ensure life-saving vaccines reach every part of our state, to keep students safe and learning, to help this state and its citizens recover, and to find a path forward toward these tough times. More importantly, as legislators, we are reminded that results matter. It is impossible to talk about the toll that COVID-19 pandemic has taken on our state without acknowledging just what is at stake. The message from communities across the state has been uncomplicated and unchanging. From North Alabama to counties along the Gulf Coast and to all points east and west, the refrain is clear: we are in this together. It is in that spirit that House Democrats return to Montgomery. We come again with a renewed commitment to work with Governor Ivey, to collaborate with colleagues across the aisle, to partner with local governments, to support state agencies and associations alike, and to be relentless in pursuing relief and remedy that serves all Alabamians. While this aim is not new, it is stronger than ever before. Today, there's no clever PR, no polished theme, just a simple, solid plan of action for Alabama House Democrats. Working together, achieving results. That's our theme. As we move into the third week of the 2021 regular legislative session, House Democrats look forward to spreading the spirit of collaboration and investment as we continue to work toward the achievement of 7 legislative priorities. Alabama House Democrats will work together to beat COVID-19 and ensure access to affordable health care, to advance education, to revitalize the economy, to reform our criminal justice system, to champion equity and social justice, and to defend voters' access to the polls. We remain committed to make many of the ambitious policy priorities that we fought for in the past, like expanding Medicaid for working families and creative ideas for generating much needed revenue for education and other critical services that are finally being embraced and advanced by majority party members. We look forward to working hard on behalf of all Alabamians in the days and months ahead, as together we fight to move Alabama forward. And at this time, my colleague, Representative Barbara Drummond, will discuss our key aim of strengthening small businesses and revitalizing our economy. Representative Drummond. We are running from one committee meeting to another this morning. Is Representative Drummond still? I know she had an 8:30 meeting. If she is unavailable, I know that my colleague, Representative Chris England, who is our caucus chair, is on the line or on this virtual meeting with us. Representative England, would you please present for us on criminal justice reform?
Absolutely. Thank you, Representative Clark, for the recognition. And it would be my pleasure to join in and discuss criminal justice reform as a part of the Alabama House Democratic Caucus's 2021 legislative agenda. Following the theme of working together, achieving results, true criminal justice reform is going to require us working together. After the most recent report from the U.S. Department of Justice on the abysmal state of Alabama prisons that detailed severe overcrowding, deteriorating facilities, awful human rights abuses, the Alabama House Democrats strongly support a comprehensive and pragmatic approach to the state's criminal justice and prison challenges. Simply building more prisons won't solve the problem. We can't build our way out of this. It's going to take more than a $3 billion brick and mortar Band-Aid to fix Alabama's prison system. A true solution starts with implementing evidence-based practices that focus more heavily on prevention and rehabilitation, as opposed to lengthy and costly incarceration in our old and dilapidated facilities. Alabama prisons and local supervision programs exist to keep our communities safe. To accomplish this goal, the system's primary focus can not only be security, but must also be rehabilitation, reentry, and a significant reduction in recidivism. To that end, Alabama House Democrats want to consider and undertake true reform in the corrections system. True reform includes serious evaluation of practical and long over to bail, probation, expungement, and sentencing guidelines that currently resemble wealth-based incarceration. We strongly endorse restructuring the Board of Pardons and Paroles to ensure fair, just, and equitable consideration. It is not only the right thing to do, but it also serves as an incentive for rehabilitation and successful societal reintegration. We support applying habitual felony offender and drug trafficking reforms retroactively. We want to address the consequences that have come as a result of the Habitual Felony Offender Act, for example, by repealing that act. We advocate eliminating coercion or deception affecting victims who are physically or mentally ill in human trafficking cases as a top priority. Measures like allowing courts to issue ex parte protection orders for individuals who pose a harm to themselves or others, such as our Gun Violence Protection Order Act. Alabama House Democrats also support community-based treatment and supervision alternatives that are both cost-efficient and more effective. Democrats believe through the implementation and expansion of prevention and rehabilitation programs, such as education, career readiness, and mental health programs, we can reduce recidivism and boost the success rate of an ex-offender's reentry into society. I have introduced myself two bills that are important steps in common sense reform that we are calling for today. My House Bill 107 would repeal the Habitual Offender Act. My House Bill 226 would create expungement to give people who've made mistakes in their past the opportunity to reclaim their future. The stark reality in Alabama is that it's not only the crumbling prisons that need repair. The state's criminal justice system as a whole needs extensive structural reform and review. Alabama House Democrats believe that we must take a hard look at the policies and practices that feed our overpopulated and under-resourced criminal justice system. We know that we can't just build or spend our way out of this problem. We are busy leading efforts advocating for evidence-based fair reforms focused on prevention, reducing recidivism, and successful reentry into society. Thank you, Representative Clark, for your recognition.
Representative Clark, you're muted.
Thank you. I appreciate that. Thank you, Representative England. Representative Drummond, would you please share information regarding our key aim on strengthening small businesses and revitalizing our economy? Representative Drummond.
Thank you, Representative Clark, and good morning to everybody. This is a very interesting subject that House Democrats take very seriously. Small businesses are the backbone, not only the backbone, but they're also the heartbeat of Alabama's economy. Today, it is uncertain how many of our small businesses will continue to survive. During this legislative session, House Democrats are working across the aisle and across the state with business owners and advocacy organizations to fully assess the impact of the pandemic and to understand the unique needs of businesses for recovery and growth, whether it's a restaurant in a local neighborhood or a once tiny startup scaling operations into a new corporate headquarters. In order to revitalize and expand growth, We must also work with local government to bolster rural and underserved economies. This means increased collaboration to support upgrades to vital public utilities and services, including transportation, broadband, and technological infrastructure. Investments in businesses and local economies will help close opportunity gaps and ensure fast, fair, and equitable access in Alabama communities. With increased reliance on virtual learning and access to the digital economy, at no time has there been a more pressing and critical need for improved access to broadband. We also are committed to innovations that will accelerate new economic growth. Our state must encourage homegrown entrepreneurship as well as find ways to attract and retain talent from around the globe. We must nurture public and private partnerships as a great benefit to Alabama businesses, particularly in rural communities. These collaborations can provide educational programs, business accelerators, mentor networks, incentive programs, and other tools to generate successful business growth. In order to help small businesses and revitalize the economy, Alabama House Democrats want to replenish the Unemployment Trust Fund. We understand the increased unemployment taxes is not sustainable, and we want to reduce the tax burden for small business owners. We want to nurture growth for all segments of the business community, including minority businesses, to give every entrepreneur a fighting chance to scale their business and reach maximum potential. House Democrats are working collaboratively with a diverse group of legislators and procurement professionals to expand minority business enterprises and disadvantaged enterprise programs. We were also pleased to secure increased tax incentives for thriving business owned and operated by minority and women by working with the House leadership to expand through the Alabama Jobs Act extension that has already become law. We were able to get language that will strengthen recruitment of minority businesses as well as women-owned businesses. Some of those action items or those action bills that the House Democrats have introduced include House Bill 172, which is sponsored by me, Representative Barbara Drummond. This bill will require the newly established office of the procurement officer and the Secretary of State to collect data relating to women and minority-owned businesses in the state and determine the proportion of procurement contracts awarded to small and disadvantaged businesses. Also, House Bill 320, which is sponsored by Representative Kelvin Lawrence. This bill will provide a cost of living increase for state employees for the fiscal year beginning October 1, 2021. Also, House Bill 251. This bill would establish a procedure by which wireless providers would be authorized to install small wireless facilities on existing poles or install new poles on the public right-of-way. Additionally, our decade-long fight to help Alabama families by removing the sales taxes from groceries will be championed again by House Democrats. That bill is House Bill 442, which is sponsored by Representative Mary Moore. This bill would phase out the state sales tax and use on food. In conclusion, the face of business in Alabama is changing. We're competing aggressively across the globe, but we must do more. Our goal is to create an economic environment where businesses and workers do more than survive, they thrive. By giving entrepreneurs and businesses the tools and resources they need, we can not only recover from the devastating impact of the pandemic, but we can grow stronger, more prosperous economy that closes the wealth and income gap in the state. This is our platform from strengthening small businesses and revitalizing our economy for the House Democrats. Thank you, Representative Clark. I will turn it back over to you.
Thank you, Representative Drummond. Representative Mary Moore will discuss our key aim of combating COVID-19 and ensuring access to affordable health care. Representative Mary Moore.
Thank you, Representative Clark. As people know, that Alabama House Democrats have had a continuous effort to ensure access to affordable health care to all Alabamians. The depth and extent of the crisis caused by the COVID-19 pandemic has shown us how urgent and critical it is that we strengthen our health care infrastructure. Alabama's healthcare infrastructure was already under strain before the pandemic. Since 2010, 17 rural hospitals have closed. Today, 63% of rural hospitals are at risk of closing, and 56% are at an intermediate risk of closing. Take a moment and let that settle in. Then consider the rise in unemployed workers, a profound lack of adequate mental health resources, and dangerous physician shortage. Hundreds of thousands of Alabamians are living without health coverage. Rural communities are weathering the staggering impact of COVID without hospitals, and larger city hospitals are bursting at the seam, managing surges from their urban centers and underserved neighborhoods. This legislature has been unwilling to address the limits of Alabama healthcare system. COVID-19 has shown us that we can no longer hide or shy away from the issue. We say it each year, and in 2021, it's no different. Alabama must find a solution to strengthening and save its healthcare infrastructure. Since 2014, Alabama has opted out of the federal Medicaid expansion. As a result, Alabama's economy has lost at least $11.4 billion in economic impact. Additionally, funds for increased federal match and state and local taxes add another $1 billion loss from refused expansion. Failure to expand has cost money, but most importantly, we have undoubtedly lost lives. With the third highest maternal mortality rate in the nation, too many mothers are dying as a result of giving birth. Among those unfortunate deaths, there's a wide racial gap, with Black women dying at a rate more than double that of white and Hispanic women. And an ADPH committee on maternal mortality found that these tragic rates were reduced with better outcomes in states where Medicaid was expanded. Alabama House Democrats believe that working families deserve to live with dignity and honor, which includes access to affordable health. 1 in 10 Alabamians is uninsured. Many hardworking men and women were left to fend for themselves and make tough, unconscionable decisions during one of the largest global health tragedies in history. Others teeter on the brink of ruin after prolonged hospital stays and mountain high bills from life-saving COVID-19 treatments. For many of the fortunate who are insured, access remains a challenge. The growing physician shortage and closure of rural hospitals has left far too many Alabamians geographically distanced from vital health care services, ranging from primary care physician to emergency room to specialists. Few, if any of us, remain untouched by the weight of the last year. The loss of life, isolation from quarantine, lost jobs and wages have incalculably impacted our mental health. Strong, accessible mental health services are more important now than ever before. This includes services for children, adults, and veterans. House Democrats have introduced 2 key bills to improve access and expand Medicaid. House Bill 432 that I have introduced. This bill expands the Medicaid program, and in light of our ongoing and rural health crisis and the pandemic, The bill will provide assistance to all persons for whom matching funds are available to the state under the Patient Protection and Affordable Care Act. House Bill 431 is being sponsored by Representative Hall. This bill extends the period during which a pregnant woman who is eligible to receive medical assistance under Medicaid may continue to receive Medicaid assistance from 60 days to 1 year after giving birth, taking direct aim at disturbing maternal mortality rate. And let me add, in Birmingham, I'm working with a group of Black doctors that provide health care to our rural communities. We found that they were not certified to give the COVID-19 vaccination in their trips to our rural communities to provide health care. So we're also working with Dr. Harris of the State Health Department to get that group certified as soon as possible so that they will be able to take that COVID vaccine to our rural communities that are in many cases have to travel a distance in order to get the vaccine for COVID, as well as make appointments to get it. So we're hoping that the last note I got this week, they're progressing in their certification. So when the next major batch of vaccine come in for COVID, they will be able to take that vaccine to the rural community. In conclusion, we realize expansion requires investment, and Alabama House Democrats are looking toward innovative new ideas for revenue generation. From looking at neighboring states, we are also sure that this is an investment that will pay off substantially in the long run. Expansion will provide jobs, attract businesses, and strengthen our state and save lives. We enter into 2021 with great hope that a renewed commitment to fighting the virus with rapid vaccine deployment will bring an end to the COVID-19 nightmare. We encourage Alabamians to continue to wear your mask, follow social distancing and hygiene guidelines, to get tested, and as soon as possible, get vaccinated. Thank you so very much for this opportunity.
Thank you, Representative Mary Moore, and thank you for reminding us that we all need to stay as safe as we possibly can by following those safety protocols. Representative A.J. McCampbell, will you please discuss our key aim on the subject of law enforcement reform? Representative McCampbell?
Now, can you hear me?
Yes, sir. Carry
All right.
on.
I had to unmute myself. Good morning.
Good morning.
The unfortunate divide between law enforcement and many of the communities they serve is wide, but it is not impossible for us to close. As elected citizen leaders in this state, we are called to approach this gap, to examine the scattered pieces and acknowledge the shining stars. As policymakers, we are called to fix the breach, to lead this state to long-term change and, in many cases, even redemption. House Democrats are listening, talking and spending time with law enforcement officers. Other legislators, activists, associations, community organizations, and professional associations in communities across this state. We are actively working to understand the next steps. And one thing is undeniably true. Alabama's communities and its law enforcement must find a way to work together to rebuild trust. You know, trust starts with accountability. And one simple truth: law enforcement must be grounded on the principle of equal justice for all. Where there isn't equal justice, we must reform policies and tactics, prioritizing the elimination of racial profiling and the excessive use of force. House Democrats wholeheartedly support enhanced training for law enforcement, including identifying implicit and explicit bias and supporting community policing methods that keep all of us safe. And when members of law enforcement break the laws they have sworn to uphold, or violate the civil and human rights of any suspect or person in their custody, they must be held accountable. Our criminal justice system must refocus on reform, rehabilitation, and public safety, and steer away from policies that stack the deck against minorities and people of color. Across the nation, the tide is turning in favor of criminal justice, police and prison reform based on evidence, facts, and fairness. Alabama must also catch this wave. And to that end, the Democrats have continued to work our broad communities to strengthen and pass law enforcement legislation. We have three bills that are our priority bills. The first one, House Bill 411, creates a law enforcement employment database. I'm the sponsor of this bill, and this bill would require law enforcement agencies to report complaints, disciplinary actions, and background information on officers to the Alabama Peace Officers Standards and Training Commission. The second bill that's a priority bill for us, the House Bill 106, sponsored by Representative England. And this bill involves the Corrections Department and require the Corrections Department to make quarterly reports to the Joint Legislative Prison Oversight Committee. The final bill that's a priority bill in this area for us would define racial profiling and prohibit officers from exhibiting racial profiling. It would require law enforcement agencies to adopt policies to prohibit racial profiling. This bill specifically relates to traffic stops, the handling of complaints, and the reporting and collection of data on injuries to state and local law enforcement officers. So in conclusion, 2020 was a tough year for frustrated and grief-stricken communities across Alabama and all over the globe. Members of law enforcement and communities together share a belief that something must change. Alabamians can count on House Democrats to continue to ask uncomfortable questions and drive the uneasy conversations that will lead us down the road to reveal reform. Thank you.
Thank you, Representative A.J. McCampbell, who serves as our Legislative Black Caucus Chair. At this time, we'll have Representative Laura Hall share our key aims on voting rights, defending the cornerstone of our democracy, and on fighting for equity and social justice. Representative Hall.
Thank you, Representative Clark. Alabama was at the forefront of the civil rights movement, and House Democrats firmly believe we can once again show leadership during this moment of unprecedented national reckoning by ensuring civil rights and equal protection for all. This includes ensuring that every Alabamian, regardless of race, gender, sexual orientation, gender identity, class, or position in life, has the same chance to thrive without facing discrimination. We're dedicated to fighting for protecting the human, civil, and voting rights of all Alabamians. The constitutional right to vote is a cornerstone of the democracy, of our democracy, America's democracy. All Alabamians have a right to know that their voices are heard, their words matter, and their votes count. So the House Democrats stand for policies that aim to ensure fair, to ensure fair districts, increased turnout at the ballot box, not to discourage or disenfranchise voters. Having a presidential election in the midst of the pandemic has shown that with appropriate planning, oversight, and transparency, secure measures can be implemented to increase voter participation and turnout, regardless of political affiliation. We strongly support the creation of a nonpartisan board to handle redistricting in our state to prevent gerrymandering. So during this session, we are working to pass a voting rights package that would include access to early voting, automatic voter registration, and restoration. Those bills would be allowing no excuse absentee voting, allowing early voting, creating automatic voter registration upon the age of 18, eliminating the requirement to pay fines and fees to regain the right to vote. And we would expand the eligibility for the restoration of voting rights. In conclusion, I will leave with these words. Racism and discrimination have no place in Alabama. It is time to move our state forward. Thank you.
Thank you, Representative Laura Hall. Representative Neil Rafferty is our platform committee chair. He will discuss our brightest future, advancing education. Representative Rafferty.
Thank you, Representative Clark, and thank you everyone who's out there watching. The surest way to change a person's condition, without a doubt, is to ensure that they are grounded and prepared with a strong education. In fact, it is impossible to overstate the importance of education. And House Democrats envision a future where all Alabamians have access to high quality public education, all the way from pre-K to postdoc. Like nearly every aspect of life, COVID-19 has rocked our education system. Our teachers, school workers, staff, and most importantly, our students have been tested like never before. So we are committed to advocating for public school systems to receive the additional support needed to overcome the unprecedented challenges and gain forward momentum. Public education is a smart investment that ultimately strengthens our economy. Investing in public education requires investing in our educators, the base of the education system. Alabama Teachers Shortage Task Force found that our teachers are paid 72% of what college graduates and other professions earn in the state. Adding insult to injury, teachers are often subsidized classroom learning from their own wallets, pocketbooks, and paychecks, and they need better wages. House Democrats will work to raise teacher and school workers' pay. It's also time that our retired educators received a cost of living adjustment. Public schools need our support, and we must reverse the chronic pattern of underinvestment in our schools, students, teachers, and classroom technology. This leaves our children at a disadvantage and discourages investment in our state. So to succeed in the increasingly globalized economy, our students must have access to broadband, the latest technology and equipment, strong teachers with good training, and opportunities that ensure future achievement. The foundation for future achievement is laid during early childhood, and we want to fully fund early childhood education to expand cradle to pre-K programs. In fact, we are especially hopeful to one day make well-rounded pre-K programs available to all of our children. If early education is the foundation for a successful future, higher education is certainly the hallmark. In addition to committing to funding early childhood education in public schools, Alabama House Democrats are committed to investing all the way up the learning ladder, looking toward our public colleges and universities, particularly our HBCUs. In growing and recovering economies, accessible public higher education, dual enrollment programs, and trade schools are more important than ever as a safeguard that ensures education as a right for all and better support families that demonstrated financial need. With increased investment in higher education, Alabama can and will offer its citizens affordable colleges and universities. And with the commitment to provide more need-based funding, we can retain our best and brightest and have one of the strongest workforces in the nation. House Democrats will work to enact bills that advance education, such as Representative Morris's bill, HB 97. This bill involves school safety and will require mental health awareness to be included in the annual training session for employees of each K-12 school. Or Representative Warren's HB 208. This bill involves public schools and will require a child to successfully complete kindergarten before being admitted to the first grade. Representative Rogers, HB 199. This bill would establish an Alabama lottery to fund education and general fund programs, create an Alabama Lottery Corporation, especially the Lottery Trust Fund. Provided that the lottery proceeds will not supplant or replace existing education revenue. And finally, Representative Daniels will be introducing a bill that will establish universal pre-K across the whole state of Alabama, so all children have access to that. Thank you very much, Representative Clark.
Thank you, Representative Neil Rafferty. Our House Minority Leader is Representative Anthony Daniels, who will now make remarks. And then on behalf of our caucus, we'll entertain any questions that you may have. Representative Daniels.
Thank you, Representative Clark. Back to our theme of working together, achieving results. It's a fitting theme for where we are in time in our state and in our country. And I just want to thank our members, all of our members, the ones that spoke and those that are introducing various bills that's helping with the advancement of the overall agenda and health and wellness for the entire state of Alabama. The social unrest and the global pandemic that consumed us last year still touch every member of our caucus at this very moment in 2021. And while I don't want to dwell on the devastation from the coronavirus and how it has endured by Alabamians, it's so tragic in the moment in 2020. It should be said that those hard times have brought us closer than ever before. As legislators, I hope our hearts and our heads are closer, that we find it easy to think beyond ourselves, our personal needs and opinions and beliefs to consider what's best for the greater good and for the least of these. While COVID-19 has impacted the entire state of Alabama, it will not indefinitely define us. We're busy at work honoring the lives lost, applauding the sacrifices of our healthcare workers, retail employees, teachers, first responders, and so many more who have banded together to push us to these increasingly brighter days. They inspire us still, and we brought that inspiration into this new legislative session. Our caucus thought it was important to take this time today to renew our commitment to collaboration and achievement. Our agenda is about hope and the belief that from our toughest days, we can work together to move Alabama forward into its brightest days. So we're already hard at work, building bridges, creating coalitions, and advancing this plan to deliver the results that our citizens expect and deserve. House Democrats will continue to work together with the corporate community and nonprofit partners to ensure access to quality, affordable health care, to protect every person's right to vote, to advance education, to strengthen the economy and small businesses that have fueled it, to reform our broken criminal justice system, to fight for equity and justice, and to usher in a new era of accountability and service with law enforcement. There's so much to be done, but I promise you, we can do it together. And we invite all who are willing to join us. Let's get to work. And so at this time, we will entertain any questions that anyone have. Please submit your question, as Representative Clark mentioned, into the chat box, and we'll respond to those questions. And you can identify the member that you would like to respond to those particular questions. Thank you.
Thank you, Representative Daniels, as we wait to see if Any questions are submitted in the chat box. While we're waiting on any questions, I'd like to mention that our full agenda is available online at alabamademcaucus.com. That's the word Alabama spelled out, then DEM for Dem, caucus.com. Our full agenda can be found online at alabamademcaucus.com. Thank you.
You're on mute, Representative.
While we're waiting, there is also a link where you can download it straight. And the link is on the screen now. It's bit.ly/AHDC 2021. And that will give you a direct download to our agenda.
You hear it seem as though there are two questions in there. One of the questions someone has asked was, how can we ensure that the vaccines will be distributed fairly?
Well, right now we're working with Department of Public Health to ensure that distribution of vaccinations are going to be distributed fairly. Right now, I think the focus is expanding distributions through, right now, I think Walmart offer a vaccine, will be doing vaccination, has started doing vaccinations. Various providers across the state, your larger hospitals, there are partnerships, even in my community, in the Huntsville area, with the churches. And so there are mass and wide distribution that are currently going on. If in fact, and a lot of the distributions are in minority communities. While it may be reported that a lot of minorities are not, you don't have the large number of minorities getting vaccinated across the state, that many times, in many instances, it is not necessarily as a result of not necessarily having access to the vaccination. It has historically been a concern, and it's a legitimate concern, especially when you look back at the Tuskegee project. And so there's some, but I will tell you that, you know, many of us that are on this Zoom, our members, have taken the vaccine, and maybe they want to give you kind of an example of it, so that it kind of removes some of the barriers or some of the fears that you may have. So I would turn it over to any member that have taken a vaccination that want to offer some type of commentary about vaccination acceptance, not just distribution, but acceptance in your experience.
Mr. Daniels.
Representative Daniels, if I could chime in right here, I've had the vaccine, and in our area, a small percentage of African Americans are taking the vaccine, and I really want to put a nail in it that all of the myth and the fake information that is circulating is just not true. The options, and this is personally for me, because I have lost so many people. As of last evening, I lost a whole couple out of Atlanta who's a friend of mine. Both the husband and the wife both passed away 2 days apart from COVID. This is really raping our community of very, very pertinent lives. All lives matter, but we can prevent this. This is something that we each have to take personal responsibility for. If we want to stop this virus, we have got to be responsible. We can't let fake information or information on the Tuskegee experiment, none of those things pass. We have got to step up to the plate and do it not only for yourself, for your community, for your families. I don't know about anybody else out there who may be watching me. This has been terribly hard because this is something that we have the power to stop. I've taken both vaccine shots, and it was very minimum. The side effects were very minimum. But I really feel like I made a giant step because that meant that I was going to save the next person who is next to me. I was going to save my family, and I'm going to be there for my grandchildren. So you've got to be responsible. One of the things that we have talked with our health officials is, and it's not an impediment, but it's certainly something that is causing people not to be able to get to those locations, is transportation, especially in rural parts of Alabama. So we're talking to the healthcare folks to see if there's some way that we can come up and partner with one of our transportation companies to give numbers in those areas where there is not workable transportation vehicles that they can take to the various locations. So I say this morning, please be responsible, because this is something that we can stop. The alternative is not only death to yourself, but death to your friends, your family, and your entire community when we hold the key in our hands. Thank you.
Representative Moore.
What I'd like to add, and I want to piggyback on what Representative Drummond has said. I think they've used that Tuskegee myth so long, and they could get away with it. I talked with, when we talked with Dr. Vickers on it, it's just that they have not been putting it out in our community. Now that they are, you could go to every site. It's full to the hilt. I've got people calling, and we're giving assistance to the bed sites to go on to make the appointment. It's just that they have not opened it up to us widely. And as I said in my presentation, there is a group of Black doctors here in Birmingham, and they go to the Black Belt, and their program is called the Spirit of Luke. What we found out, the state health department was not certifying many of your Black groups that are going into the Black Belt and rural communities to give the vaccination. So we're working to get them vaccinated as soon as possible. And what I'm going to encourage the caucus to do is to write letters to Dr. Harris to support any and all groups that are seeking certification to be able to provide service to our rural areas.
Thank you, Representative Moore. And we have another question being asked through Facebook. Katie?
It says, greetings. Thank you all for making the time today.
Can't hear you.
Can you hear me now?
Yes.
Okay. Our question is, do you see support for Medicaid expansion among the members across the aisle?
What I do see is, I do believe that COVID has exposed the vulnerabilities in our healthcare system. And so that is undeniable. I think that, colleagues on both sides of the aisle, on the other side of the aisle, also understand the impact and the devastation that this horrible pandemic has caused in their communities. All of the untreated underlying health conditions have caused many in their community to be more vulnerable and susceptible to not being able to overcome this particular pandemic. It also has caused issues post their first 10 days, or their being COVID positive. Is causing respiratory issues that folks are unable to really get shake. And so I do, to answer the question, I think there is an appetite for folks on the other side to want to do some form of expansion. And so we're going to have a heated, really good debate about that. But I do think that there is an appetite, and we're hopeful that the President of the United States will exercise allowing states that did not expand to be able to start over from year one. And that will certainly put folks in a very awkward position, because it's harder to turn away that money if we're able to start over from year one. And there's someone that has a hand raised, US02 Web US. Yes, you can unmute yourself. Yes. All right. We can't hear you, so if you could put your question in the chat because we can't.
Hello, can you hear me now, Representative England?
This is Representative Daniels. I know we sound alike and we both have round heads, big heads, but yes, ma'am, we can hear you.
Representative Daniels, I know it's Representative Boyd.
Yes, ma'am.
I wanted to, there is a reporting reaction for the COVID-19, which monitors any side effects. There's an online, there's a phone number, the Department of Health, and what it does is keep data. I guess I should have I've had both shots. Even at my age, no reaction from the first. The second one, I experienced some of these that they're saying common reactions or symptoms that you might experience, like pain, redness, and swelling at your injection site, fevers, tiredness, headache, chills, vomiting, diarrhea, and new or worsened muscle pain, joint pains, and swollen lymph nodes. Only on the second one did I have a little effect of, but mild. But
Okay.
it's better to having minor side effects and not taking the vaccine at all.
Well, we certainly appreciate
Representative Boyd and Leader Daniels, I might say that all of those symptoms that Representative Boyd just read off, I think every one of those appears on every medication that I take, as a possible side effect, and I don't have any of them. So I hope and pray that while those things have to be stated, that people are not experiencing many of those symptoms at all. But thank you, Dr. Boyd, for bringing those things up. We strongly encourage everyone to take the vaccinations and to help to make our community as safe as possible for the good of us as individuals, for our families, and also for our entire community. Again, if there are no additional questions, we do look forward to working very hard on behalf of all Alabamians. We thank everyone who has tuned in to hear us present our agenda this morning. Thank you to all of the participants. And if there are no further questions, Representative